September is Sickle Cell Awareness Month, and thanks to gene therapy research, the word cure is finally being used when talking about the disease. Senior health correspondent Monica Robbins talks to a patient who received the experimental treatment, who not only got her life back, but is now focused on a new career.
Sickle cell disease can cause oxygen-carrying red blood cells to become sickle or crescent-shaped, which slows or blocks blood flow. It causes excruciating pain and devastating damage to the body.
I can compare it to pregnancy for women when they're giving birth, like worse than that or comparable to for some.
Annyanna would know, diagnosed as a child and used to the pain episodes. She didn't even realize when she went into labor with her son Kalani 9 years ago. Her disease and pregnancy took a significant toll on her body. So when she learned of a clinical trial testing gene therapy, she signed on for her son and his future children.
He's a miracle baby for sure. And he keeps me going. He keeps me going. And I knew I had to do this not only for him, but for me, because I want to be there to grow up with him.
In January, she underwent one-time gene editing therapy. It modified her stem cells to correct the genetic mutation that caused her disease. Her cells were taken, re-engineered, and before they were given back, she underwent chemotherapy to clear the remaining bone marrow and make room for the improved cells. Today, 9 months later, there's no sign of disease in her body.
This is really a functional cure. I am very pleased and confident in using that word, and I intentionally use that word because this is what family and what patients are using nowadays. It is allowing them to regain their quality of life.
While the treatment doesn't help previous damage, it does seem to prevent further damage. And while expensive, Dr. Hannah says this study is health equity in action and being covered by Ohio Medicaid.
And setting the standard nationally, because we have now patients, regardless if it is a private insurance or a government-based insurance, we are seeing our government-based insurance payer accepting this gene therapy despite it being expensive, so that we can offer this therapy to many patients who needs that.
It changed Annyanna's life and future. She's now in school studying to become a nurse.
This is when medical care can truly not only save the lives, but they can make them thrive, so they can really become functional citizens and contribute and achieve their dreams.
Now, the study expanded to kids as young as 12, and they hope that in a year or two, they'll be able to submit for the biological acceptance from the FDA. But this is certainly something those with sickle cell should be talking to their doctors about. And there is an effort to get cell and gene therapies for sickle cell covered by government insurance. As you heard, Dr. Hannah says Ohio already taking part. There is a federal program set to start next year, but it's not clear how many states will opt into it. That's something we have to keep an eye on.
I don't know that we can overstate. This is a significant medical advancement that impacts probably millions of Americans, right? Or hundreds of thousands.
Hundreds of thousands of people, yes, yeah. It's a very huge thing, and it's certainly something that is addressing systemic racism that people have been dealing with for eons.
Yes.
So, yeah, the fact that the government is stepping up and covering this incredibly expensive treatment, but bear in mind, this is still a clinical trial.
Right.
You know, we're still dealing with 2 different gene editing therapies right now that are in clinical trial, so it's not approved yet. But don't be surprised if this does become standard of care, and when and if it does, that price we hope to see come down.
Wow. Yeah, because it's currently over $1 million.
It's very, very expensive.
Yeah. Okay. Yes. It's a great, great step forward.
Absolutely. And Ohio is setting the standard.
You love that.
Who knew? Yeah.
Mon, thanks.